As many as 100 employees at Amazon.com's Staten Island fulfillment center in New York City, known as JFK 8, plan to walk off the job at 12:30 p.m. Eastern Time today, alleging the company is mishandling its response to the COVID-19 outbreak. Among the demands, employees want the facility closed, cleaned, and sanitized because as many as 7 workers have reportedly been diagnosed with the disease at the warehouse alone. In a statement to CNBC, Amazon calls the organizers' accusations, quote, unfounded, adding, quote, our employees are heroes fighting for their communities and helping people get critical items they need in this crisis. We are working hard to keep employees safe while serving communities and the most vulnerable. We have taken extreme measures to keep people safe, tripling down on deep cleaning, procuring safety supplies that are available, and changing processes to ensure those in our buildings are keeping safe distances. Joining me now via Skype is walkout organizer and management assistant at the aforementioned Amazon Fulfillment Center, Christian Smalls, who an Amazon spokesperson notes is, quote, on a 14-day self-quarantine requested by Amazon to stay home with full pay. The company adds he was placed in paid quarantine out of an abundance of caution because he was notified that he may have had close contact with someone at the building who was diagnosed. Christian, thank you very much. And I first of all hope that you are doing well from a health perspective. Take us through what exactly is the impetus behind the actions you are taking walking out on the fulfillment center operations today.
Yes, no problem. First of all, I want to say thank you for taking the time to interview me today. I'm being the voice of the people. I'm being the voice of the people that are afraid to speak up. I'm taking a stance against the company. I've been with the company a little over 4.5 years. And this right here is the tipping point for me. I'm standing up for those who cannot speak for themselves. What caused this walkout pretty much started a few weeks ago when I brought to the attention of the company that people were being sick in my department daily. I witnessed people have various symptoms, dizziness, vomiting, people fatigue. People were just being sick, and it was like a domino effect. I tried to escalate this to my senior team, my HR reps, and they pretty much shut me down. They're saying, you know, we have the unpaid option, which doesn't really help us if we're trying to, make ends meet, bring money into our family. We can't afford to take off work just because we don't feel safe at work. It's not fair to us. So that was one thing I didn't agree with. When the first confirmed case happened, that happened on March 11th, I was in the building. The entire company was in the building. We had an activities committee that day. We don't know how long this guy had the virus. We don't know anything. All we know is that somebody tested positive and my employees felt unsafe. From that moment forward, the building should have been shut down, just like the previous building in Queens that was shut down and sanitized. That's all we were asking for at that time.
Christian, here's my question. If this were to happen, what exactly would make you feel better? We know what the demands are, but are there immediate steps that can be taken by Amazon to address these concerns to help keep this operation up? I say this only because Amazon has become a pivotal service for many people in America who are trying to get through this COVID-19 crisis. The shutdown of a facility like this disadvantages a lot of folks in the community. What can be done to make sure that Amazon and other fulfillment centers from other companies stay up and running so that people like me can get the goods that we need?
I'm gonna be honest with you, Don. I understand that we're doing a service to the community in the public eye, but to be honest with you, that is not entirely true. I work with the outbound department. I see the items that customers are ordering firsthand, and the items are not as essential as people think they are. They're really not. Our inventory has been depleted as far as essential items for weeks. They didn't narrow down the inventory like they claim they have. And what service are we doing if we're infected? My warehouse alone holds up to 4,500 people. 5,000 people come in and out that building weekly. We're still hiring. And we have known positive cases that were in the building. We do not know how many people were affected. We do not know how many people are exposed. They can't narrow it down. They're not informing the employees who have tested positive, that other employees that's working around them, they're not even giving them the opportunity to make that conscious decision to risk their lives and come in to work. We're not doing the community no good if we're bringing home the virus to our families. This is the number one thing. Just do the math. It's 5,000 employees. The virus can affect up to 2.5 people. We're in the epicenter of the pandemic. This is New York. We have all 5 boroughs in the building. We have 2 states in the building. We have people that's riding the subways, the buses, public transportation. And good luck getting the test in the state of New York right now. It's very hard to make appointments. It's very hard. The time you get the test is days later. The time you get the results is days later. And from that moment, the company does not pay quarantine until they have a confirmation letter from the doctor.